All right. Welcome everybody. Today we have a career event with the medical assistant and phlebotomist. So you'll be getting that information. Don't forget to check in. This helps your counselors know that you are currently at the event and not doing something else you're not supposed to. And then over on the left, we have the great questions document. So these are great questions to ask the presenter. I know you get a lot of information and you're like, I don't know what to ask. These are perfect questions to ask. And then we also have the evaluation form. And so that's the way that we make sure that you get career credit for attending this event. And it's best to do it right after the event so all the information is fresh on your mind. Okay. Again, be fully present. Try to stay off your phone. Try to stay off social media. And then, pay attention to the presenter and take notes. And then again, don't forget to do your evaluation. This is what you need to get the career credit. All right. I think that is it. And I will go ahead and put the links in the chat. And what's the last thing? If you guys feel comfortable leaving your cameras or turning on your cameras, you won't show up on the recording. So you'll be fine to turn them on. All right. I'll let you guys take the lead now.
All right. Excellent. Well, thank you so much for joining us today. What we will be going through is both some information today and also some activities so that you can be thinking about what it is that you're wanting to accomplish for yourselves and for your career. So I would love to be able to share my screen here. Give me 1 second. May I have sharing?
Yeah, I thought I gave you. Okay, I think you should be good to go.
All right, excellent. Thumbs up if you can see my screen. Cool. All right, great. So the first thing for today, my name is Gretchen Lively. I'm part of the admissions team here at Concord Career College. And I am here with Tony Jones, an experienced healthcare professional in medical assisting, who will also be here to do some Q&A today for you all. I would love to be able to share some insights with you. Our programs are great for students wanting to get into a healthcare profession. So we'll be focusing specifically on medical assisting. If everybody who is in attendance today could grab something to write on and write with, whether it's a notebook or another tab that you've got available, you're going to want those here in a couple of seconds. So first off, I want you to be thinking about this in a really holistic way. Like not just, okay, well, do I want to be a medical assistant? That may be a great question to ask, but we want to take a step back and first be thinking about this from a broader view. What makes you proud of yourself? Because we want to be there to help you learn about healthcare, to master skills that will help you make you an asset with your patients and with your community. And if you like helping people, but you're not necessarily sure if you want to do a different helping profession like being a teacher or a counselor or something like that, healthcare may be the perfect way for you to be able to serve your community and really align with what makes you happy. So I would love to be able to do an exercise together to be able to think about those things, to give you a path that you can be considering to be able to continue to learn in the field and keep learning and growing, because healthcare is great for that. I would love for everybody to take an opportunity to share with the group. So name a talent or a strength in the chat box. It can be anything you want here. So this isn't just about when you're thinking about finding your path. It's not just about like how much you make or what you want things to look like for yourself. It's also about like using your strengths. What are the things that you enjoy? What do you feel like you're good at? And so while those things are certainly things to be thinking about as well, we want to be thinking about this again from that holistic perspective of what's going to be really fulfilling for you across the board and build you the kind of life that you want to have. So while you are sharing that, I'd love to give you a little bit of overview for the school. So Concord Career College has several different pathways. So just to give you a broader perspective real quick, a little zoom out, we have several different programs that are all of our 8-month long trainings, such as medical assisting. We do medical assisting, dental assisting, medical office administration, so running the office in a doctor's or dental office type of thing, and then polysomnographic technology, running sleep studies. And then our longer, heavier clinical programs are practical nursing, surgical technology for those that want to work in the OR, or respiratory therapy. So we've got a little bit of something for everybody. And another time to just like think about, there are so many different roles to be able to help in healthcare. So many of us maybe heard like doctor, dentist, nurse. There are so many different roles to be able to help out in healthcare. Medical assisting is a fantastic way to get started, but there are even more past that as well. Our programs are really hands-on programs. That's something that's really central for us. But of course, we also just want to make sure everybody feels confident and comfortable being here, because we are obviously in the middle of a pandemic. So I don't want to leave that out. Everything has been adjusted for COVID-19. So, these some of these pictures are pre-COVID, as you might expect from the photos. Everybody's wearing masks to be here on campus in their classes. We're wiping things down. So I just want to throw that out there too, so that you can just know what to expect there. Because even though we are doing all a combination of lectures online and training that's super hands-on for your labs, we also want to make sure we're doing it in a way that's keeping everybody safe. So you're going to be here to not only learn about healthcare, but master those skills that are going to make you an asset for your patients and for your community. And so for the next piece here, as a medical assistant, and Tony will be able to speak a little bit more to her experience for this later in our presentation as well. To be a medical assistant, you can think of yourself as really that point person that's making sure that a doctor's office is really humming, because you're doing a little bit of everything to make sure that patients are getting helped and that they're getting the care that they need. So you're going to be taking patient histories and vital signs, entering data into patient records, handling administrative tasks such as scheduling appointments, calling in referrals, keeping supply inventories in the treatment rooms and the offices stocked, gathering blood or other samples and preparing them for laboratory tests, assisting doctors and nurses during examinations, and other basic clinical tasks. Think like cleaning and dressing wounds, giving injections, starting a cast, whatever the appropriate thing is for the patient that you're seeing at that time. Because it's the medical assistant that makes sure that the doctor's office is running smoothly, whether you're in a specialty doctor's office like a cardiologist or a podiatrist, or whether it's a family practitioner that is your like family doctor, think your pediatrician. So wherever you land, and that's also something to be thinking about for like how you want to grow as a medical assistant. You have different ways that you can be learning specialization stuff within your field with that on the job training. So something to think about there as well. For the coursework that you'll be covering in our program, you'll get training in medical records entry and data management, medical office administration procedures. Think the front end, making sure that that things are running smoothly for scheduling appointments, billing, some things like that. Healthcare legal and ethical considerations, super important stuff. Taking patient vital signs, common diagnostic tests and how to prepare samples, and basic first aid and CPR. The CPR training is actually part of our program itself as well. So you get that here too. And by the way, if anyone has any questions, you can be typing those into the chat box as we go as well. But you can also be sort of saving those for the end, whatever makes sense for you. Our program is set up as a hybrid blended program. Well, what does this mean? So that can mean different things to different school setups. For us, you will have a combination of lectures, labs, what we call career path to success modules, and your externship experience as well. So lectures are fully online lectures that are still live lectures. So you actually choose your time of day in our program. You can choose mornings, which are 7:30 to 12:30. Afternoons are 12:30 to 5:30, or evenings are 5:30 to 10:30. Whichever one that you're choosing, it's a 25 to like 27-hour a week time commitment between the class time that you're doing with lectures and labs and your homework. So it's a blend of things for that. So whatever you choose, you're doing morning, afternoon, or evening classes Monday through Thursday. 2 days a week are virtual from home or wherever you've got internet to be able to attend your classes. And then 2 days a week here in person for that same time frame that you've chosen, to be able to get that hands-on time, getting that practice, being able to do blood draws and spinning off samples for blood samples, all kinds of things. So you're going to be EKGs, all of the pieces of the training that you're going to be getting here as part of the program, the really hands-on stuff. That's what you're going to be doing in your lab days. So again, it's 2 days a week for those virtual classes online, but still live classes where you're asking questions in real time, talking to your classmates, etc. And then 2 days a week where you're doing that in-person component for that hands-on training. And then we have the true online component for your classes. It's going to be your career path to success modules. So modules, kind of some educational speak, that basically just means like chunks of stuff you're doing. In this case, for us, your modules are your week's assignments. So you've got career path to success modules that are going to cover the soft skills that employers report that they're looking for. So things like time management, effective communication in the workplace, that kind of stuff. So those things that you'll sometimes hear called transferable skill sets. So the things that will serve you whatever kind of a job you're working in, those things that'll just make you a stronger professional overall, to then go along with the classes that you're taking that are specific to medical assisting. So for the first 6 months, that's what you're doing: your lectures, your labs, and your career path to success modules for that Monday through Thursday schedule. Then the last 2 months is when you're doing your externship component. This we actually set up for you. We have a clinical coordinator who is going to take everybody's information into account, put it together like a big puzzle, and then let you know where you're doing those hours out in the field. So you do not need to find your own externship. That's one of the things that is really helpful in our setup, is that everything that you need to get started in the field is already part of the program itself. So you can anticipate that here too, whether it's the CPR training or getting your externship lined up. We also set up and pay for your first attempt at your certification examination. All of those pieces that are part of getting out in the field, those are all just built into the program for you. So you can just focus on being the best student possible and ultimately the best job applicant possible at the end of the program. We're really student-centered. That's a very important thing to us. So we help support our students end to end for getting started all the way through graduation and getting out there into the field. So you also have things to help support you with that, like our Learning Resource Center. This is our school library. We'll talk more about that here in a minute. And then you also have Student Affairs, which is a big part of your student resources here. They help out with things like free tutoring. They coordinate that between your department and themselves. And then they also help out with employment support, which, by the way, is a lifelong resource for you. So whenever you're wanting to talk with them, not only will they be showing up in your classes and talking about things like resume building and professionalism and things like that to get ready for your interviews, but then they also help out with just like a slew of other things, we have free mental health counseling for our students and their immediate families. We have different resources like food scarcity resources. We do grocery handouts to just make sure folks have what they need on that front. So we've got all kinds of things for you as a whole person, not just as a student. But then, of course, the graduate support for job hunting is a really important part as well. So they help out with things like resume building. We have mock interviews on campus for you to be able to practice those interviewing skills. Funneling job leads to you when you're getting ready to apply out in the field, and that's something that we have 17 campuses across the country. So we also have a pretty large network of different resources for you to be able to access. So let's say you're moving to Florida and you want to look at some job opportunities there before you even move down there. Well, we can get you connected with that. So be thinking about not just what are your resources when you're a student with us. Those are of course very important, but also once you're a graduate, you're still part of the family. So let us know. Okay, so what you'll get having been part of the program. So as part of our medical assisting program, you will be finishing your diploma to show that you've completed your course of study, and then we also set up and pay for that first attempt at what we call your double AMA medical assisting certification. It is um, uh, for you to be able to show those qualifications not only for your education but also to be able to say, here I passed my exam. That's the goal, is to set you up to be able to sit and get your certification at the end of the program as well. Important to note, we are accredited by the Accrediting Commission of Career Schools and Colleges, as well as by the Commission on Accreditation of Allied Health Education Programs. Okay. So the Learning Resource Center, I mentioned that we have a bunch of resources on campus. What we affectionately call the LRC, is our school library. It is actually part of the Multnomah County sharing system as well. So you can check out books just like you would at any other library, but it's also a really great study space. Just as these students are here, again, a pre-COVID picture. Now we have the tables spaced out a little bit more and everybody's wearing masks in there too. But we have those spaces for you to be able to use our computers, as well as not only if you're on campus, but also we have loaner laptops that we get for students that would like to borrow one of those for the duration of the program if you need it. So let us know just anything that we can do to make life easier for you as you're getting into your studies. We want to make sure we're getting you covered. Here we also have some more information about the career focus, because again, that's a really important piece. We want to make sure everybody just feels really good about that transition. So part of qualifying for a program is having a conversation with me or one of my colleagues on the admissions team to make sure that we're really talking about your options and making sure that this is something that's really going to align with what you're hoping to accomplish for yourself. Because that's what we do, is really focused career centered coursework, and we want to make sure that everything that you're doing really makes sense for you for that, so that you're going to be happy in your classes and really excited to get out into the field and do your thing. I mentioned that we do set up externships and clinicals as part of that, and all of those wonderful things that Student Affairs is going to work with you on. Built-in externships or clinical experiences are just part of every single one of our programs, so that you can be building that professional network for your future career while you're still here as a student. So it's really important to also be thinking about this in terms of like how you're going to be growing that network as a student. That's part of what you're getting in a career college like this, is that you're making those networks with what are going to be your future colleagues in your classes. So you'll want to be thinking about that too. Now, a big question for a lot of students is, how do I build a resume? How do I even start that process? We got you. So Student Affairs is going to be coming to your classes. They will be talking with you about that, but then you can always go and visit them in their offices on campus as well to be able to talk with that. They're really your one-stop shop for not only the things that you need as a student, but also once you're moving on to be able to get out in the field. We also really want to make sure that we're here to help you master your skill set through the relationships that you're building. So we do have a lot of different things here, whether it's being in your lab space, whether it's doing community building activities on campus. This is truly your space. Student Affairs has just like a slew of different things that they do for you in addition to academics. So I also really encourage students to take advantage of that, because we want to make sure that we're also putting some additional emphasis on things like self-care as a healthcare professional. That's something that I hope you all will hear a lot if you decide to go into this field. We do things like yoga days out on the campus green, things like that, to make sure that you're also thinking about how you're going to be taking care of yourself, not just while you're a student, but making those habits as you get out into the field. So I hope everybody grabbed that notebook and pen as part of our um, uh, thing here today. Our presentation is also going to be doing an exercise. So really thinking about what it is that you want to build for yourself. So I want everybody to be thinking about what you want to create, thinking about not just like what you want that your job to be, because that's a question that's on a lot of students' minds. Is, well, what do I want to do? It's not, again, it's not just about like what you want to do for your career, but what you want the whole picture to look like, because that can be really helpful information as you're thinking forward to that. So I want everybody to be imagining what your dream life looks like 5 years from now. So just a short time frame. This isn't like a 30-year down the road kind of exercise. This is a shorter one to be able to see what your next step is and what you think that first milestone is on your journey for what you want to build. So this is a blue skies kind of anything is possible exercise here. So be thinking about what that's going to be. Pick a day in your future life and begin creating a movie in your head from the time you get up in the morning to the time that you're going to bed. So when you get up, what does your home look like? Who wakes up in the place with you? Is there a roommate? Is there a partner? Are there pets? What are you wearing when you get ready for your day? You have your dream job already. What do you think it might be? You're getting ready to walk out the door and go to work. What do you drive? Is it even a car? What role do friends and family play in your future life? Do you want to see them a lot? Do you not? When do you want to hang out with them? In your future life, you take vacations sometimes. Where do you want to go? Where have you just come back from? What else does your field enable you to do? What do you look like? What does your 5 year from now person look like in your head? And how does all of this make you feel when you're thinking about it? I hope that this exercise has been helpful to be thinking about what you want to create. Because again, it's all about the big picture. If we're focused in on just like, well, what do I want? What do I want to do for my job? There's so much more to life than that. And while this is one aspect to be able to get you where you want to be, doing a program of study like this to be able to get started in a career for medical assisting, it's also about what you want to build from that. So what it enables you to do, where you want to grow from there. And I also really want to put out there that it's also about how you want to create those milestones for yourself. We have students that have had amazing careers where they're really, they love doing what they do as a medical assistant. You also have opportunities for this to be like a foot in the door. We talked about how this can be a way to be able to get exposure to a bunch of different doctors' offices and see if there's some other specialization that you want to pursue from there. There's a lot that you can be thinking about. So I would really encourage you to be writing down some other questions for yourself as well that are important to you, maybe that that this exercise brought up for you. And then we will also be sharing the floor here with Tony here in just a moment. Tony Jones, she is a certified medical assistant, and she will be speaking a little bit to her experience here. I would love to be able to hear any individual questions that you all put out there. We also have ones that that were asked ahead of time, so we've got some of those as well to be able to talk about. If we could open the floor, you guys are welcome to either Catherine or Goldilocks. I don't know what the preference is. Do you want people to type in the chat, or would you prefer that they like just say it out loud? Do you have a preference?
It's whatever they feel comfortable with. I've noticed a lot more people put questions in the chat. So if you guys want to put it in the chat, that's great. If you want to unmute your mic, that's also great.
Okay. So Tony, if you would like to give a little bit of background so that folks can have a sense of what kinds of questions they can ask.
Yeah, so right out of Concord, I actually got hired on my externship site. It was just a family practice. I was there for about 8 years, and the doctor I worked for retired. So I worked for specialist in gynecology for a little bit, and now I'm back in primary care, which I love. And you get to do a lot of different things with it too. Like you said, the specialty clinics are nice, but I feel like with primary care, you kind of get exposure to a lot more stuff.
Okay.
Okay, we have a few questions in the chat. I can read them out loud. So one of them, what high school courses have you found to be the most applicable or important for this occupation?
I would say that that's a little bit hard to answer for me because I don't know what high school courses are available now to the students. I graduated in '99, so that was quite a while ago.
If I may jump in as well, for our program, we don't have any prerequisite coursework, so there isn't like a checklist of things that you have to already have under your belt. Our program is going to teach you everything that you need, start to finish, to get out in the field as a medical assistant, and for all of our programs of study for that matter. That being said, there are some things that can sometimes be useful. I've had some students, if you are thinking that that maybe you do want to go for even more training later on down the road. I've had several students that have mentioned that having a little bit more like science and math background can be helpful if you're going on for further training. But again, it really just depends on what you want to do. Also, when you're still in high school, you've got a little bit more, when you get here, you're going to be focused on medical assisting. If that's what you're doing, that's all your classes. So if there's anything that you also want to make sure that you're taking for fun while you're in your last year, that might also be something worth considering. So doing that nice balance of not only the things that can give you a good foundation to be considering how you want to continue to grow in the medical field, but also depending on what kinds of resources your high school has for you, what kind of things you also want to do that are going to be enjoyable. That's also, again, thinking back to that like self-care and sustainability for yourself as well.
Yeah, that's great.
Mhm.
What age do you think it's possible to start working and building experience as a medical assistant? Do you guys have, Tony, do you have any like younger people in the staff, or what do you guys see from experience?
Absolutely. And to be honest, I mean, fresh out of high school and then taking the course and then going into the working field is sometimes better because with the externship, you're at a job essentially. You're doing the job functions that any MA would be doing at that point, and so you can kind of learn from there. And sometimes work will, depending on the job, they do prefer to hire the externship students because they have that experience, and then they can kind of mold them to how they want to fit best in their clinic. So age really
Okay,
doesn't matter. I started when I was 29. I went back to school, so age doesn't matter.
okay. And what does a normal day look like? And what do you wish you would have known when you first started?
A normal day for me, it's pretty much Monday through Friday. I saw another question about there, how's the balance between family life and job? It's a Monday through Friday because normal medical clinics are those hours, and you're usually working 8 to 5. A normal day is I come in and kind of open the clinic. We start seeing patients. I room them, and then the doctors go in. I also do phone calls, faxes, paperwork. Um, and just kind of managing your time between the patients and the
Okay. And I guess this kind of goes with the balance between job and family. Do you guys get like paid leave and um, all those healthcare benefits?
absolutely, and it just depends on which company you work for and what they provide, but almost any medical job you get, will.
Okay. Do you require to have, or yeah, do you require to have any experience in CNA, or should you have taken CNA classes first before applying to the program? So I think this works for either one of you
It's not
guys.
required. Yeah, it's not required. My prior experience was I was a caregiver, I was a med aid, so passing out medications. So that combination of experience prior to me going into school did help me with school a little bit, and then afterwards. But to be honest, it kind of like Gretchen said, it's all encompassing in the course. You learn everything you need to know to start working in the field.
Mhm. Yeah, I would absolutely second that. So while um, it's not necessary for you to have previous experience, whether in a related field or something similar. In general, it's just helpful to have that confidence that yeah, this is totally a field that I'm going to enjoy. So if to that end, it's helpful for you to work in a field. A related field, you can, but we don't require that you have a CNA or anything like that under your belt. That's actually, a certified nursing assistant is often in different kinds of facilities as well. So you're going to be getting the training that's really specific to working in what is typically a clinic experience as a medical assistant, which by the way, they are generally Monday through Friday, 8 to 5. That's definitely the case for most of those. Every once in a while, though, these days we also have more urgent care settings and things like that. So that's also something to consider. You may also find some places that have Saturdays or extended hours or things like that. So if you want that, you can sometimes find those places
Right.
as well. Those just won't be quite quite as common for the job description.
And Tony, would you choose this career again if you can make the decision again?
Absolutely. Yeah. Like I said, I was, 29 when I started, so I had some experience in other fields and also as a caregiver med aide, and this kind of just lines up with what I've wanted to do, and I would do it again. Nursing is good too, but those typically work 12-hour shifts and at the hospital, and those are different. It's just a different aspect of the medical field versus medical assisting is, clinic setting and more get more comfortable with your patients because I like that.
Okay, and here's the fun question. So how much does a medical assistant on average make?
I've been doing it for 10 years, so I think I make a little bit more than beginner. So I don't know. Gretchen might be better with answering that question.
As an entry level position, the data that I can share, we do track that information for our graduates. For our students that graduated between 2019 and 2020, the median, so the average salary for students that were joining the field was $17.20 an hour during that group. So again, that is already like a year and a half old information by the time I can share it. So I definitely encourage you to
Mm-hmm.
check out what people are making now. But then also taking into account things like experience can be really helpful as you're looking at those postings, to Tony's point as well.
Mm-hmm.
Yeah, and then I have, well, not necessarily a personal question, but I just wanted to hear from you guys, how has COVID changed? How medical assisting worked. Has it changed that much?
In the beginning, when COVID first started, we were trying to get everyone to virtual visits. So trying to eliminate people coming into clinic, we had to wear a lot more protective equipment and stuff like that. So I mean, it did change a lot, but now we're kind of more doing a lot more in person, but still some virtual visits, which to be honest is kind of nice because I work at a clinic that has the elderly population, so it's nice for that option. So that way they don't have to come into the clinic.
Yeah, from what I now, to be clear, I help people get started in medical assisting, but I have not worked as a medical assistant. But what I have heard from our students that are going into the field, and from our student affairs department that helps with those placements, is that it has changed some of the protocols. But at this point, so much of that, making sure that you're keeping an area sterile after you do a blood drop, well, that was happening before COVID anyway. So many of the things
Right.
that you would be doing as part of your job, um, perhaps we're a little bit more careful and thorough and might clean a bigger area because of when you're trying to make sure that it's sterile, not just for um, you know pathogens and working with biological specimens, but ultimately also for that larger, that 6 foot radius or whatever. There are those kinds of things that I think have been tweaked, but honestly, you're a medical professional, so you're still going to be doing a lot of many of those same protocols, whether we're in the middle of COVID or not. In a lot of ways, it's just sort of been like turned up. And now we also have folks that are looking at working in COVID clinics specifically and things like that at the moment too. So that's actually something that's changed with COVID, is that now we have different kinds of centers to be able to help um, uh, make sure that we're doing good testing and it's really specific to that. So there have certainly been some changes, but not, I think perhaps not as drastic as is sometimes envisioned. Would you say that that's about right, Tony?
Yeah, definitely would have to agree with that. A lot more cleaning, wearing the masks, but obviously everyone's doing that. So, and then we also have to wear, N95s. It just depends. But th- not a lot much has changed.
All right. It looks like we have
Um,
one last question. So what's the program's name again, Gretchen?
This program is for medical assisting.
And it's with Concord Institute
Yeah, Concord Career College.
Career College. Okay.
Mhm.
If you don't mind, can you drop the link in the chat just so students can easily access that information?
Absolutely. And if you would like to talk more about it, here also is my contact information so that you can get a hold of me that way as well. This is my direct line that's listed there. That QR code also goes straight to my calendar. So if you want to schedule a time either for a quick call just because you have some questions, I've got an option for that. Or if you want to schedule a longer time to be able to like really get into the program details, talk about your options, talk about multiple fields, even do a little compare and contrast. That's literally what I'm here for. So let me know if there's anything that I can do to help. And I will also definitely put that in the chat.
All right. So I'll go ahead and stop the recording.